Hi everybody, my name is John Diamond. I'm the CEO of DocDelta. So DocDelta is the talent search engine for healthcare. A bit like Moneyball, we help hospitals find the best clinicians that nobody else is looking at. So hospitals have this huge problem. A typical hospital has around 15% of vacancies open at any one time. This means millions of patients aren't getting treated, and it's costing the system millions in lost patient revenue and referrals. To make matters worse, there's a war for talent between competing hospital groups. This is driven by the shortage of physician and nurse specialties in key areas, as well as this focus on population health dynamics that's driving a lot of M&A and practice acquisition activity. So DocDelta helps hospitals win this war for talent using predictive analytics, big data, and our software platform. We have a highly predictive analytics model that leverages big market data, social data, and medical data to create our job mobility and performance scoring. And in just a few clicks, a healthcare administrator is able to search our comprehensive database of providers. We have around 3.5 million in our database currently. And our current customers are already enjoying a 46% increase in new candidates that they weren't seeing previously. And we're just getting started, so this number is obviously going to increase over time. Our current clients are paying us between $50,000 and $200,000 a year to access our platform on a subscription model. And we're addressing the $14 billion healthcare staffing market. Our team has over 35 years' experience in the world of digital health, healthcare entrepreneurship, predictive analytics, and software engineering. And we have traction. We're currently generating revenue from the world's largest healthcare staffing firms, as well as a number of New York-based healthcare systems and hospitals. We're currently raising $850,000 to execute on our vision of bringing data science and predictive analytics to the world of healthcare staffing. We've got almost around half of this already raised. So if you're interested in getting in touch, becoming an investor or a client or finding out more, please come see us after the presentations. We'll be at the demo tables in the purple t-shirts. Thank you.
Can I start quickly? So just to clarify, are you mainly going after flight risk? So actually losing a physician associated with your network or hospital, or recruiting?
This is a great question. When we started the business, we wanted to go after retention as our primary metric. What we found is that CFOs don't have a budget for retention, but hospitals understand staffing problems very well. So we are starting in the space of recruiting, but we can see future developments into the world of retention.
And so if you're starting with recruiting, you're basically scraping from social, LinkedIn, other sources, putting it into an algorithm and saying, here's the best candidate for an open job? Is that how your product works?
Yeah, pretty much, except we use a lot of big medical data, so Medicare data, Medicaid data, referral data, etc. So it's pretty complex. It's not just social data. When we started the business, we thought we could be focused on using social data. Unfortunately, most healthcare professionals are not on LinkedIn, Facebook, etc. So we had to find different and innovative ways of increasing our sample pool to be all encapsulating. So it's this combination of big healthcare data plus social data, market data, etc. that is essentially feeding our system.
Okay. So it was really great looking at you guys. I don't know if you guys, if I'm on. I was twiddling with my earphone here. Before I was at Box, I was at Morgan Stanley Ventures, and we did Doximity, the Series B, and clearly credentialing, recruiting are really interesting opportunities when you have an asset of physicians that you've assembled through multiple data assets. I think I looked at you guys a ton in the portal when we were doing the judging. I think what I'm the most interested in is your customer. So I'm very familiar with AMM Healthcare. They're a Box customer, know them well. I'm curious if you could expand and automate out of just recruiting and predictive analytics of who might be the best customer and move more into credentialing, if that's something that you think that would expand, because nobody is really automated credentialing. It's state by state. It's really long. It's very paper intensive. Is this something that you've thought about?
Yeah, absolutely. It's certainly something that we see in our product roadmap as we go. There's just 4 of us working on the team so far, and we've been at this for about a year. So this is how far we've come. But absolutely, we're already using 70% of the data that is used for credentialing in our model. So it's a very easy next step for us to look at that as a next piece.
So question about really the metrics that your customers are looking for to see for their buying decisions. So you've showed us here that you can identify an increase of 46% of available candidates. But what's the conversion of that? What kind of data do you have to provide your potential clients so that they understand how that translates into value for them? Are they looking for how many of those 46 really come in for interviews, get narrowed down? How does this become a quality metric that communicates the value of the software platform is what I'm looking for.
Okay, it's a really good question. So I think it depends on the customer. A client like AMN has enormous call center resources. They have big systems and processes in place that they're using for recruiting. And for them, it's just about being able to find candidates. They have no problem in demand. They have a problem in supply. So this is really to help them identify new sources of supply that they weren't looking at previously. In terms of hospitals, again, the type of candidates that we're going after in the model that we're looking at is passive candidates. So we're not finding people that have typically applied to job boards, etc. We're finding people that aren't really on most people's radar. And those are typically the best employees, the people who aren't shopping around in a B2B market, and we're seeing similar metrics in healthcare. Quite frankly, we don't have enough metrics yet to give you like a really nice concrete answer. We're just getting started, but all indications are moving in the right direction. The 46% is based on a test we've done over about 3,000 physicians, and so we found 46% more candidates that weren't on anyone's radar. And for the hospital groups as well, they're seeing value in business development activities, so which practices to acquire, which sort of who to go after. So that's the other side of the market we're addressing.
What's the data science provenance of your team? Have you done this kind of work before?
So 2 of our co-founders, myself and another gentleman, worked at Sermo, which was the original Facebook for doctors. Our co-founder, Simone Gabriellini, is a PhD with expertise in agent-based modeling and social science. He's well published in that field, and he's helping us develop our models and test them out.
How much revenue are you actually generating today?
We're generating something like 20,000 a month, but we've got short-term contracts based on pilots, so I didn't want to make too much about that.
And when you think about the number of potential customers and installation sites, how are you thinking about that in terms of not just the total addressable market of the whole recruitment, but more about the business opportunity and how much penetration you can get into that marketplace, either in terms of dollars, sites?
Yeah, absolutely. So we see that there's around 5,000 hospitals as sort of the lowest hanging fruit that could be very interesting. The flip side of this is, of course, if we know who's most interested in leaving, we have a very good tool to create something interesting in the locum space. So just finding people who are interested in extra work, addressing the 1099 market, which could be very interesting as well. So yeah, that's where we see the opportunities. There's a lot of opportunities for us. Right now we're focused.
The local market is a really great place for you guys to play. I was very impressed with your sort of predictive flight risk model, because temporary, anybody that's going to be a contractor or be temporary, and you can move into ancillary providers as well, and clinicians. It's a big market, and that's why at AMN Healthcare, who's like number 1 and 2 in the nation on hospital staffing, is needing new sources of data, right? Because to your point, supply is really challenging.
Absolutely. Yeah.
Thank you, John.
Thank you very much.
Yeah, great
Thank
job.
you.